extended community health dialogues tonight. And in our studio, we have Ms. Lisa Randall, who is with the Minnesota Department of Health. She's a policy specialist, and we're going to be talking about something that many of you probably have heard about, but maybe not had a discussion about it. But I talked to Lisa, and I just said, let's start from some basic things here and talk about HPV, which stands for Human Papillomavirus. And it's an important one because it's one of those topics that come up quite frequently. And I think when I was doing some background studies on it, CDC estimates that approximately 80% of all sexually active people will be infected with at least one HPV in their life, and that half of those will be high risk. And we want to be able to kind of sort through these things and talk about them and understand why we as a community really need to be aware of this virus and really how we should be taking care of ourselves. So, Lisa, welcome to our show.
Thank you very much.
So we're going to start with some real basic things. I want to start about asking you, what is a virus?
So it's a little chain of proteins that it's not even really a living organism. It's something that wants to get into your cells and just make more copies of it. And that's really its whole purpose of existence. So it can get into your cells, make more copies, and it doesn't really care, but at the same time that it's making more viruses, it can be killing your cells. And so that's why they can be bad for us.
So you say it's not a living organism?
Well, sometimes people talk about live virus vaccines or killed virus, so we kind of imply that they could be alive, but there's nothing, they don't have organs, they don't respire, they don't have the qualities that we think of as characterizing living organisms exactly.
Okay, but they are very dangerous. They can be very dangerous.
Yes, absolutely. Many of our very serious diseases are viral diseases.
So one of the things that I also was looking at was, what I wanted to ask you, what is the difference between bacteria and viruses? Because I know, people sometimes will say, a common cold,
Yep.
A common cold, you just let it go, but there's some other things that you have to use some more heavier dosage of medicine.
Yep. Well, to be honest, a viral infection can be mild or serious, and a bacterial infection could be mild or serious. When we talk about, say, meningitis, we've been talking about viruses and they kill your cells and they're really bad, but actually viral meningitis is typically not as serious as bacterial meningitis. So it kind of depends on the organism and how it's going to affect you. The one thing that is important to know about viruses versus bacteria is that antibiotics only work against bacterial infections. So that's why people say sometimes if you have a cold, don't bother trying to treat it with antibiotics because there's nothing there for the antibiotics to work against.
It's very interesting because we've had nurses on this program that are just saying that doctors are overprescribing these things, and so they're also saying some of the same thing that you're saying. Antibiotics is like, we're going to become immune to them.
Right. It is a concern, the antibiotic resistance from many angles. You talk about agricultural use and overprescription in humans, and I'm not an expert on that at all, but it is certainly something for us to be aware of.
So I started off the program by talking about that more than 80% of people that are sexually active will be infected by one of these by HPV.
Yep.
And someone else said that that's approximately 14 million people a year. That's a lot of people.
Yep, it sure is. And I think that's probably the number one thing that is not appreciated about HPV, that this is just ubiquitous. Like you said, 80%, your chances are overwhelming that if you are just a normal, everyday walk-around adult in this country, you are at some point going to have at least one HPV infection. And I think the reason we aren't that conscious of it is because there's usually not a reason for us to be conscious of it. You get this infection, and there's many types of HPV. That's the kind of how they're classified. So there's about 40 types that like to infect the genital or anal tract, and a good number of those are never going to do anything. They'll be in there, they'll replicate a few times, and then your body will kick them out, and it's not going to be a big deal. But there are some of those 40 types that are going to want to get in there and stay around. And it's when you have that persistent infection that eventually that can cause some cellular changes that can be precancer, and then eventually, if nothing happens to stop it, such as having a procedure like you've had a cervical exam and caught a precancer, or sometimes you have precancer and your body just heals itself too. But if nothing happens, that's when you can end up with cancer from this virus.
And you said they're like 40 for the genital and anal area, but there's over 100 or 200
yes, exactly.
other places.
And that's where you get the warts on your hands and feet and other places like that. So the different types have different places where they like to reside. There's actually, this is a little bit gross, but I'm going to tell you.
Okay, tell us.
So there's, if you've ever heard of a jackalope, so that's,
sure.
The mythical creature, a rabbit with
I saw one.
with antlers, right? I have actually too, and let me tell you that actually comes from a rabbit papillomavirus.
Okay.
They can get, it doesn't infect humans, thank God, but they can get this rabbit papillomavirus that causes them to grow these big, long warts on their heads that look kind of like antlers, and that's how people got the idea that there could be such a thing as a jackalope.
Yeah, well, actually, I saw one run across the road. I thought it was a dog, but it was a jackalope.
It's pretty arresting, isn't it?
Yeah, very okay. So let's talk about the trouble that these viruses can make, and why is it that we should be having this conversation about HPV?
Yeah. So the HPVs that we worry about, which is, like we just talked about, a subset of the 40, they can do three things. So they can get into your tissues and cause genital warts. There are just 2 of those 40 that are responsible for 9 out of 10 cases of genital warts. Mm-hmm. And then there are some, like we said, they just don't do anything. And then there's the high-risk types. Among the high-risk types, there's 2 that are really the bad actors. Those are types 16 and 18. And those are the ones that we really want to keep people from getting infected with. And the places that they can infect, there's just certain types of tissue where they can find lodging. So the places where they can infect and can potentially turn into cancer are, I would say, in rough order of incidence, the cervix, the oropharynx, which that can happen in men or women. So that's it's a name for a particular part of the back of the throat. And then probably the next largest after that is anal cancer, which also can happen in men or women. Then there's vaginal and vulvar cancer in women and penile cancer in men. So a whole variety of places that you have to worry about.
Well, one of the things that we had talked a little bit earlier about was the fact that, you're given a lot of statistics about the impact of this virus. Mm-hmm. We're talking about how many people are impacted by it, but it's not always given a good report in the community. So,
sure.
let's talk about that a little bit. What's the story behind people just really not wanting to hear this information about HPVs?
Well, I'll tell you what I think is kind of behind HPV vaccine, people having gotten kind of a funny feeling about it. Mm-hmm. About 10 years ago, when the vaccine was first, finally licensed after many years of testing, and FDA, the Food and Drug Administration, licensing it to be used as safe and effective for the population, people felt like the manufacturer was a little bit coming on too strong and kind of trying to be a little bit too active and encouraging states to make this a required vaccine for school. And people kind of got a funny taste in there, about that. And also there was the fact that at first it was only recommended for girls. And I think people didn't really understand, well, what kind of vaccine is this? There's no other vaccine that this is recommended only for one sex, so what's going on with that? It was, a few years later, also recommended for boys, but I think people just felt like, there's something weird about this vaccine. And I think that fed into the concerns that people had about safety. Anytime you give a vaccine, you don't know really what's going on inside your body. You know that, well, gosh, antibodies are forming, but what does that feel like? And
especially when they're dead, right?
Right. So very often, something will happen that you don't have an obvious explanation for. And if it happened the day after you got a vaccine, you tend to think, oh, these things must be related. That's just the way our brains work, and it's a natural thing. So there were some reports of people having, weird neurological things after the vaccine, and that got a lot of media play. You never hear the story that, maybe is 2 inches in a column a week later that, oh, you know what, they found out that girl that they thought, died from HPV vaccine, she actually died from an overdose of cough syrup. The vindicating story never really makes the headlines in the way that the scary story does.
But I think a lot of people were concerned because of the age that people were recommending that they get the vaccine. 11, 12. I mean, come on. So
right, and so the fact that it was linked to gender, I think, brought up more than it needed to the idea that this had something to do with sex, and really the whole idea of giving it when it's recommended at 11 and 12, or can be even given a couple years before that, was ironically, to get away from the whole link to sex, because thinking, well, we're not really thinking about sex being an issue until, at least 15 for most kids, and we know not always, but, let's go a couple years before that, and then we won't, this won't be something that says, I think you're about to go out and have sex now, but it really, that really hasn't worked out, because people do kind of still link this vaccine with the idea of starting to have sex, which I think is unfortunate, because, like I said, this is such a ubiquitous disease that it's not a disease of having sex a lot. It's just a disease of being an adult. Okay.
So are there specific populations, that you're seeing a lot of cases of HPV occurring? I mean, we have a very diverse community. Are there certain populations, certain pockets? You talk about HIV. You talk about MSM. There are certain ways that people are identifying it.
Maybe a little. It's really, it really affects all parts of society. A couple of exceptions would be not that you're more likely to get HPV, but you might benefit more from having been vaccinated, is people who don't have good access to health care. So some of the cancers that HPV can cause have a precancerous state associated with them. So if you're getting regular screening, and cervical cancer is one of those. If you're getting screened for cervical cancer, then even if you didn't get the vaccine, then you would be likely to have your cancer caught at the precancer stage and never go on to have cancer. But if you don't have good access to medical care, then maybe you don't get that, and you'd be more likely just to go straight to cancer. So people who, for economic or whatever other reasons, don't have good access to care, we think the vaccine is probably more important to them, not because they're going to have the disease, but because they're going to benefit more from never having needed the screening. And then the other group that I'm thinking of is there's still a difference in how HPV is recommended for men and women when they're not teenagers anymore. There's a recommendation for women to get the vaccine through age 26, but men are only recommended through age 21 unless they are men who have sex with men or immunocompromised by having something like HIV, because there's more proportional benefit to them. And so you could say, maybe a little higher risk for them. But in general, we really want to make everybody understand that anybody, and actually almost everybody, is going to need the protection of this vaccine.
So when you talk about you want everybody to do it, what are some of the reasons people are really just saying, like, no, I just don't want to do this? We're not trying to create any additional drama.
Right.
But I think, if people can kind of understand or have explained to them, why their thoughts or their ideas are not necessarily the most correct.
Yeah. Well, I think, honestly, it's right. We've come to a time when it's not so much a hard, no, I don't want it, but more it's not a priority for me today. Let's do it next time I'm at the doctor, kind of thing. And certainly there are people who, if they've just got the wrong idea about this, or for some reason, or they really are giving a hard no. But the two things that I think happen are, first, somebody saying, you're 11, but I'll see you again. I have to give you these other 2 vaccines today. I won't make you have 3, and this one hurts a little more, which, to be honest, it does.
Is it longer needle?
I don't think I think it's just a more stingy stuff inside.
Oh, okay.
It has to do with the other ingredients besides the antigen.
Okay.
That's what all the kids say. That's what my kids said.
Okay.
It kind of, it hurt. Anyway, but totally worth it. Anyway, so thinking that they're, it's just, we've got plenty of time, and you do at 11, but if another year goes by, another year goes by after that, and then maybe you don't really have plenty of time at that point, especially since you need 6 months to get all 3 doses to get the full protection of the vaccine. So there's that, the kind of, let's just do this another day kind of. I don't think it's that, obviously you don't need the protection today, so let's do it tomorrow. And just kind of putting it off, and then, maybe it's not so much in the routine to get it at your visit when you're 14, so nobody thinks of it then, and maybe it just never happens. So there's that. And then the other thing that I think happens is, especially with kids, 10, 11, 12, the provider or the parent or both feeling like if we're going to give this vaccine today, then we need to have a discussion about sex and sexually transmitted diseases. And that makes some sense. But what we think about at the health department is when we give polio vaccine, we don't give the vaccine and then say, and stay out of contaminated water, because that's how you get polio. And when we give tetanus vaccine, we don't say, and here's some things that you should watch out for, rusty metal, shards in the backyard. We don't talk about how you get the disease. We just, it's enough for kids to know what could happen if they don't get it. That's pretty much what they want to know. And so with HPV vaccine, we think, unless you want, you feel like it's appropriate to go into a discussion of sex and sexually transmitted diseases at that time, it's enough for them to know that, this could prevent you from having certain kinds of cancer in the future.
So let's talk a little bit more about that, because I think that was my next question. What should parents be saying to their children? What kind of conversations should parents be having among themselves about this particular piece?
Well, my attitude really is answer the question that they're asking, and maybe that is no question. Maybe they're only asking, can we go for ice cream after, because this really hurt? Right. If they want to know, how do I get HPV? I think it's safe enough to say that, adults have sex, and this is a common thing that can happen from having sex, and
but certain kind of HPVs, right? I mean, so you said genital warts. I mean, warts. I mean, that doesn't come from having sex, does it?
Genital warts, yes.
Oh, I'm not. I mean, talking about warts on your lips or something.
Oh, right. Yeah. No.
Okay.
Are you thinking of herpes?
Yeah, but that too.
Okay. Not vaccine preventable, unfortunately. Maybe someday.
Okay. No, I got some more. Anyway, okay, go ahead. Okay. So, I think one of the concerns people had about HPV was that all of a sudden it just came up.
Right.
There was this like all of a sudden it was like every place you went, it was like HPV, and folks were just
and
like,
it can feel like a cell job, can't it? Because wait a minute, where was this disease 30 years ago?
Right.
We didn't get vaccinated against this when I was growing up.
Sure.
And you're absolutely right. But what we have grown up knowing about is Pap smears. And I myself didn't really make the connection until our division director pointed this out to me, a while back, that, well, what do you think you're looking for when you have a Pap smear, which is this, very ordinary, uncontroversial thing that every woman accepts you should have periodically. Well, you're looking for the pre-cancer when you get a Pap smear in your cervix, and that only comes from HPV. So all this time, our mothers and grandmothers have been getting Pap smears, and nobody felt the need to say, and by the way, I'm looking for damage from a sexually transmitted virus. They just did the exam because
but I think that was because it was couched in very safe language, and it was like, well, this is just normal. So
right.
HPVs are normal.
Right. But nobody ever said, HPV screening. It was always just Pap smear, which is kind of a, fun little term. It sounds like, going to the pop stand, having a Pap smear.
Okay.
We weren't talking about HPV, the virus, but that is in fact what it's looking for. So, if people don't think Pap smears are anything, threatening or scary or controversial, they shouldn't have those feelings about HPV, is how I look at it.
So going back to the history of it, it's been around for 40 years, 20, 30 years?
Not that long.
Okay.
The development started in the 1980s.
Okay.
And took a long time because it's a disease that takes a while to develop. Like I mentioned, there's with cervical cancer and anal cancer in men, there is a precancerous state, which happens obviously before the cancer itself. And so they were able to at least do studies that took people who had and had not had the trial vaccine and looked for those precancers to develop. which so they were able to accomplish those studies in years rather than the decades it would take to wait around and find out if these people ever ended up with cancer. You can get cancer sooner than that from HPV, but in the main you're not going to see a ton of cases for probably 20 years after the person is exposed. So it took a while to compile that data, and the Food and Drug Administration licensing process is very rigorous, and they had to prove that the vaccine was safe and that it was, it worked, it was worth giving to people. So then finally in 2005, 2006, it was licensed and brought to the CDC, the Centers for Disease Control, where its recommending committee considered it and decided, yes, this is a safe vaccine, it's effective, it's something that at that time all girls should get, and then 4 years later, all boys should get as well.
So we know that according that you said that viruses are kind of dead. Mm-hmm. Okay, and but how do you create a vaccine for something that's dead?
Yeah, well, it's interesting. There's a number of ways of constructing vaccines, and I'm going to give you probably about a second grade version of this.
Okay, that's
I'm not
good.
an immunologist.
That's about what I need.
In the main, you make a vaccine by taking the infectious particle, whether that's a virus or a bacterium, and making it, hobbling it so it can't infect you anymore, but it can still be in your body, and your body can recognize it and say, oh, this is something foreign. I'm going to make some antibodies against this. And then those antibodies continue to circulate, and then if you ever get the real infectious kind, the antibodies are right there to latch onto it and kill it. What they did that was different with the HPV vaccine was they developed a way to have other organisms, yeast cells, if I'm remembering right, to just make the outer protein coat of the HPV virus. So that makes it very, what they say, immunogenic. So it prompts your body to make a very strong immune response. But there's none of the mechanics inside that could actually cause an HPV infection. So it's a very safe vaccine by design.
Okay, so you were talking about people getting a little stinger.
Yes.
When they take one. Are there other side effects? To taking HPV?
Yeah, but they're really the same side effects that can happen after any vaccine. So you can have some redness, soreness, definitely at the site of the injection, and maybe even a little more with this one because it is, you feel it. And those were all documented in the clinical trials, and not surprising because many vaccines have that same effect. And then more kind of general somatic symptoms like fever, nausea, headaches, a little bit of fatigue. So the normal kind of things, well, A, that happen to people routinely for other reasons, but B, might be associated with an immune response being generated, which, if you think about it, is really good news. You want your body to sit up and take notice that this is a pathogen that you might need to defend against in the future. And actually those were documented in the clinical trials, and because I think in part there was so much kind of public nervousness about this vaccine, there have been quite a number of independent studies coming from different places, just looking at, can we document that the good safety record that was seen in the clinical trials bears out in normal population use? And the answer is yes. There's been no new concerns identified in any of those studies.
So how many vaccines have they given out?
As of about a year ago, I want to say the number was 67 million just in the United States, and of course many more than that in the rest of the world.
So take us through the process of getting a HPV vaccine. A parent comes in.
Mm-hmm. And there's many places that you could get this.
Okay.
So if you have a medical home, certainly that would be, if it's a place that treats children, certainly they will have this vaccine available. But public health clinics will almost always stock it. I guess I haven't checked into this, but I would imagine certainly that school health clinics in Minneapolis and St. Paul would be able to furnish this. And you might have to consent specifically for vaccines, but I believe it is something that they will routinely give if it's needed. I know that pharmacies stock it. I don't know how often they give it to to teenagers, but I believe that they are able to give it to people 13 and older. So lots of different places to go.
Is it just one shot?
It is 3.
Oh,
but one
3
per
stingers.
day.
Okay.
You don't get them all on the same day.
Okay.
So there's the one, and then you wait usually a couple of months. It could be as short as 1 month, but usually you wait 2 months and you get the second dose. And then you get the third dose 4 months after that, so 6 months after the initial dose. And it's good to get them in that sequence if you can, because then you've gone start to finish, and you've got the whole series done, and you're as protected as you can be as soon as you can be. But if life gets in the way, you get off track, you maybe got the first or second dose and now it's been a year, you think, oh gosh, do I have to start over? No, you do not have to start over. Whenever you can complete the series, you should do it.
So we know that it's recommended that young people get start the vaccines early, right?
Yep. And you actually can even jump the gun a little bit. So CDC always says get this at age 11 or 12. At the same time, you get the other 2 vaccines that are recommended at that age, so which are the meningococcal and the Tdap vaccines. And that's great. That's good. If everybody did that, we'd be in great shape. But you can actually get HPV vaccine as young as age 9. And I think it didn't really fit with the, get all 3, so the nice, neat little package, but there's really no downside in getting a little bit early. Then it's done and you don't have to worry about it. And this vaccine has exhibited very good durability of protection. So you don't really have to worry that if you get it at 9, it's going to wear off at 16 and then, oh, shoot, what am I going to do? It's actually from the very first people who were enrolled in the clinical trials more than 10 years ago. They're still being followed. And as of the last reports, none of them are really showing a noticeable reduction in their levels of antibodies. So every indication is that this is a very long-lasting vaccine, and there's no reason not to give it soon.
So you feel like it's effective, right?
Yes, it has very impressive effectiveness numbers, actually. If we look at cervical cancer, kind of the biggest thing that we think of that HPV vaccine can prevent, it prevents of the 7 types that are prevented by the vaccine most commonly used in Minnesota, 97% of cervical precancers. So if you think of you take 2 really big groups of women and you give one group the vaccine and don't give the other vaccine. If for every 100 cervical precancers in the non-vaccine group caused by those 7 types that the vaccine addresses, you would see maybe 3 cases in the vaccine group. So a difference of 100 in the vulnerable group to 3 or maybe even less in the vaccine group. And that is a very impressive efficacy rate, even for a vaccine. And, we always say vaccines are, your best chance, and, there's just no question. It's a no-brainer. You should do it. But this is even more effective than most of our other vaccines.
So what about for men? What about for men? Is it as effective for men?
Well, the efficacy men is slightly less impressive. It prevents about 3 out of 4 cases of anal precancer. Still a very good rate, and I believe that its efficacy against genital warts in men is also slightly less high than it is in women, but still very much worth getting. And another thing to remember in men is that most women get their HPV from men, so they're not only protecting themselves, they're protecting their future partners.
Okay. So are people running to the doctor now to get these vaccines?
Not as much as we would like, and
Okay.
it's really surprising because everything we've been talking about, very safe, very effective, in most instances isn't going to cost you a penny as the patient, but still only 6 out of 10 girls and about 4 out of 10 boys have had even 1 dose in Minnesota.
Really?
If we're looking at 13 through 17-year-olds. So they're over 12, they've had time, they could have had all 3 doses. So, averaging the sexes, half, which is really unfortunate and much lower than have had, say, Tdap vaccine, which has been around forever and nobody, thinks it's anything to get all a Twitter about. We probably have 9 out of 10 have had Tdap vaccine, and only 5 out of 10 have had HPV vaccine. So that's really unfortunate. And if we look at the full series, so the number who've had all of the doses that they should have had in that age group, it's maybe 40% of girls and 14% of boys. So that's pretty dismal.
So what's the issue? I mean, why don't people want to do this? I mean, we've talked about the fact that there's some hesitation about it, but I mean, the numbers that you're giving are really kind of dismal, especially when you start thinking about the young people that are sexually active. They're doing what they're doing. I mean, so what's the real big deal?
Yeah, well, I think maybe sometimes it's the patient or the parent saying, let's not do this today, or let's not do this at all. But sometimes it's the provider, maybe not being as enthusiastic as would be warranted about, saying something more like, we could do this today, versus I recommend this for all my patients. Maybe they're a little bit shy, that the parent is going to think, well, what are you saying about that? My child is going to have sex someday. Well, your child is going to have sex someday, unless it's a very unusual case. And, we're not saying by giving the vaccine that it's going to happen tomorrow. And in fact, there are studies specifically on that question. People had worried that, maybe, if we give this vaccine, we have to talk about sex. Is it going to mean, this person's going to have sex sooner? And they actually have documented no. If you look at the medical records of people, young people who have had the vaccine or not had the vaccine, you don't see any difference in how often or how soon they do things like coming in for birth control or STD screening or pregnancy, anything like that. So it's not even that there's no evidence for that idea. There actually is evidence against the idea that the vaccine brings on sexual activity. But, there's sort of the idea maybe that, if you talk about it, you're saying something about your patient that the parent isn't going to appreciate. So maybe that makes them shy. I don't know.
Well, I think it's an interesting conversation. I mean, the fact is that no one is saying that the child will have sex, but it is something that will protect the child. And again, I'm just trying to figure out, what the big the struggle is for people, because I think if we're talking about something that 80% of us will get sometime in our life, I mean, it's like this is not rocket science.
Right. And maybe part of it too is that in the main, when you're 11 or 12, you're seeing a pediatrician or a family practice provider, but somebody that you're not going to be seeing when you're 40.
Right.
And so the consequences of HPV infection maybe don't come home quite as vividly to the providers for young people as they would if we were talking about, say, Haemophilus influenza infection, which is very serious, very immediate, takes kids down and can be fatal, and everybody who takes care of kids knows exactly what that is, and they're very afraid of it. Maybe the providers who don't see HPV cancers and even the precancers, which are nothing to sneeze at. You need procedures for those. Maybe they don't quite have, they're not quite as impressed as they would be if they dealt with those every day.
I know that we had talked about this earlier in terms of the overall piece about the number of people impacted, but I think a lot of the conversation has been focused on kids. So should more seasoned people of my season, should we be also taking the virus?
Taking the vaccine?
Yes, vaccine.
Well, it wouldn't hurt you. But the assessment is that by the time, you're probably 30, 80% of us, by the time we're 50, will have been infected at least once. So that, every year you go along, the less and less the vaccine is going to be able to help you, because of course you can only be helped if you have the vaccination in place before you're exposed to the disease. And as we go along through our adult lives, we have exposure after exposure, and by the time you get to be a full-grown adult, it's hard to benefit, because you probably have already had to fight off the infection all by yourself.
Okay.
Yeah. So it's not licensed for people older than 26.
Oh, okay. Interesting.
I think that there are studies ongoing. I probably shouldn't even be saying this because I haven't looked this up, but I think that there are studies ongoing in women as old as 49. And I'm not surprised that it's taking longer to generate this data because it is hard to find people to study who are what they call HPV naive at that old of an age, because it's just so uncommon that you would not have had an HPV infection once you're that old. You have to take people who don't have the infection and then either vaccinate them or not and see how many end up infected. And it's just hard to get that uninfected number out of people who are in their 40s.
So you mentioned a little bit earlier that people in underserved communities many times are impacted more by this issue.
Yeah.
Is that because the vaccine is expensive?
Well, it really shouldn't be, and that's a funny idea that providers have had sometimes, that their clients are going to get a big bill for this because the cash price of the vaccine is on the high side, and you need 3 doses, so then it's 3 times that. But there's, as far as we're seeing, there's almost no circumstance where, particularly as a preteen or a teenager, so the ages when you really should be getting the vaccine, when you would end up having to pay for it. So if you are insured, you have a private insurance or, just talking about private insurance for the moment, this is among the standard benefit set that almost all health plans have to cover with no cost sharing, as they call it. So there'd be no copay, no co-insurance, that kind of thing. So you're good on that front. If you have an insurance plan like Minnesota Care or medical assistance, definitely a covered benefit. If you are, with both of those, I should say, if you're concerned, if you have reason to doubt, can I get it at this provider, you can always call. There's a number on the back of your insurance card, so you can call that and get a determination just to make sure that you're not going to get a bill. If you're uninsured, so you have children who don't have insurance or they have a bad insurance plan that doesn't cover vaccines, they can be eligible for the Vaccines for Children program, which is run by the state of Minnesota. It's a federal program, locally administered. And most pediatric healthcare providers in Minnesota participate in this. So that's a way for a free vaccine to be given to qualifying children. And very readily available. All the providers know about it. So it would be a pretty rare instance where Minnesota family of children would end up having to fork out money for this vaccine.
There's also a underinsured vaccine program?
There is. So if you are over 18 and you're not eligible for the Vaccines for Children program anymore, the state of Minnesota has set up a separate program called the Uninsured and Underinsured Adult Vaccine Program, which is very descriptive, kind of a lot of syllables. In the office, we call it the UUAV program. And it's a smaller program, so not as many providers participate in it, but still several in the metro area. So I would think that the broadcast area of KMOJ, people could find a lot of providers that participate. And so this is a way, if you're an adult eligible for HPV vaccine and you have no insurance or you have bad insurance and you don't have coverage to get HPV vaccine, the clinic can give you the free doses out of this program.
Okay. So where can parents go to get more information about this vaccine? I mean, I think we've had a long conversation, and I think you brought up some very, very interesting points, but you also have a JD behind your name, so I expect that from you.
Thank you.
And the MPH,
Thank you.
And I want to thank Dr. Wendy for, really setting this program up. And I'm going to get back to that, but I really want people to understand that Lisa came as a result of a conversation with Dr. Wendy Hellerstadt at the University of Minnesota School of Public Health, Maternal Child Health Division. And she's been providing us with some interesting and wonderful guests for the next couple of months. Talking about issues that are impacting our families and issues around maternal child health. And so if you want to know some more information about maternal child health, you can just Google University of Minnesota Public Health, maternal child health. And I recommend that because I think that maternal child health is a wonderful way to enter into a conversation about healthier babies. And I think that that's what we're doing. And that's what Lisa here is doing, talking about how do we have healthier children. So anyway, I said all of that to get back to this point.
I totally agree. That's where it all starts.
Okay, that's it. But I want to know where can people get more information about HPV. I mean, because sometimes some people just want I heard you, but I'm not really feeling what you're saying.
Yeah.
We get some more information.
Yeah,
So.
you need to. It's an excellent idea, actually. Triangulate your information, and if all your reliable sources are saying the right thing, then you can have a good degree of confidence. So we always recommend talk to your provider, your normal medical provider that you have a relationship with, and if you want to do some more reading, or you want to be prepared to find out what questions you even want to ask your doctor. MDH has, Minnesota Department of Health, has a website that we have set up specifically to talk about adolescent vaccine needs for teens and their parents, and that is vax4teens.com. So Vax, V-A-X, then the number 4, teens, just the word teens, T-E-E-N-S,
okay.
vax4teens.com, and that is just a short URL that brings you to a regular Department of Health webpage where we've put some information and resources for teens and their parents about, what vaccines do I need? How can I afford them? How can I find out if I've already had them? So all the questions that, people would typically have. And if people specifically do want to know what vaccines they have or haven't had, this is on Vax for Teens too, but they can call our a really nice service we have. A lot of people don't know. It's called the Minnesota Immunization Information Connection, which is our state immunization registry. So the providers of vaccines, for the most part in Minnesota, contribute all that data into one big database. So whatever provider you're at, that person can see what vaccines you've already had. And you can find out what your child's record is in the registry too. You can, your provider can look it up, but if you don't want to do that, you can call the Minnesota Department of Health. Our MIC is the name of the registry. Our helpline is 651-201-5207.
It's interesting about that list. I just saw mine.
Did you?
2 days ago. I was just going through some papers. All of a sudden, I saw it.
Yep.
What's your final thoughts for our listeners?
Well, I really want everybody to understand that the HPV vaccine is safe, it is effective, and it works against something that almost all of us are going to need. Not all of us would have the most severe consequences of HPV, but you don't know if you're going to be the unlucky one who would just roll the dice and end up with cancer out of this very common virus. So no reason not to get that protection in place, and it's a great gift that you can give your kids. Great.
Lisa, I want to thank you for spending this evening with us, and I want to thank Dr. Wendy for setting this up. And our listeners, I want to thank you for listening to us. And we will be back again next week on Community Health Dialogues, talking about issues that impact the community, but also we want to create information that will help us to have healthier children. Have a great evening.
Thank you for listening to Community Health Dialogue, sponsored by North Point Health and Wellness Center. Join us next Monday from 6:30 till 7 for more discussions for a healthier community. KMOJ, Minneapolis, St. Paul.